Today, the Central Drug Authority has been discussing what happened and how we can protect young people from substance abuse. Nomcebo Dlamini is the Deputy Chair of the Central Drug Authority. Nomcebo, good afternoon to you. We have such a big problem with underage drinking, and I hate to say this, but I can't help but think it may actually have got worse in the last few years. I mean, is there any evidence? I mean, there's no measure that I've seen that's been introduced to actually reduce underage drinking since we lost young people at Enyobeni.
Good afternoon, Stephen. And, listening to the lady speaking, I am just shattered in my spirit. And it is true, the problem has gotten worse. It has not gotten better. And more and more communities are struggling with this challenge. And in terms of what happened at Enyobeni, the South African Human Rights Council has come out with a report, and the Central Drug Authority was part of the work of the SAHRC in terms of compiling this report. And there has been failures by the Eastern Cape Liquor Board, which have been highlighted in that report. The Buffalo City Metropolitan Municipality also had its own failures in terms of appointing a local drug action committee. And this is something that we're seeing in a lot of communities. The mayors are not appointing local drug action committees. And we all know that issues at local level can be dealt with if we have the structures that our legislation allows to have in existence. But unfortunately, that is not the case. And the problem definitely is getting bigger. And if we do not do something about it, we might see another Enyobeni, and none of us want to see that happen.
I mean, in a way, you talk about listening to the mothers, the families of the children who died, and I can't help but feel that the state failed them in that their children were able to drink so easily. The state failed them by not really controlling the taverns. The state failed them by, as you say, not appointing the right committees. The state failed them again when they died. I mean, they still don't know why they died. I find that part of the story still unbelievable. I'm amazed no lawyers taken that to court, frankly. But the state, from what you say, is still failing today. I mean, the risk of this happening again is very high.
Yes, the SIHRC report actually came out with some kind of a report regarding what actually happened. And it says that there was methanol poisoning, and later that was, so basically the initial reports were that it was methanol poisoning. And that later, that was refuted, and it came to suffocation due to overcrowding. The inconsistency has exacerbated the distress of the families. As the lady has said, it really is troubling that after 2 years, and this is what we're actually commemorating year number 2 right now, and we still are not clear as to what happened and what is to stop a similar incident from happening. But of course, that's something that, as you indicate, the state needs to be dealing with. And the Central Drug Authority does have a responsibility, because remember, the Central Drug Authority has 21 departments of government in it. And then it has the independent members, such as myself, who are also supposed to ensure that the state is doing that which is supposed to do. We are supposed to ensure that there's best implementation of the National Drug Master Plan. And that is something that we are coordinating. It is something that we are pushing. And the issues of alcohol in this country are even bigger, according to investigations that have happened, more than even the illicit drugs. Alcohol is a legal drug in South Africa, unfortunately. And maybe that's the reason why, when it comes to issues of alcohol, they're not taken as seriously as they should be. And that's something that we need to be looking at.
Some countries have been able to reduce the amount of alcohol that people drink. And they've done this. I mean, banning alcohol I don't think works. But they've done a couple of things. They've reduced the hours that liquor stores can be open. They've completely banned alcohol advertising, which we still haven't done, despite, laws on the books for years. They've made it more expensive as well. Are those things we should do too?
I think the critical pieces of legislation that have been on ice since about 2016, like the Control of Marketing of Alcohol Beverages Bill and the Draft Liquor Amendment Bill, those need to be tabled and they need to be enacted. We need to do that. And there is, of course, the economic argument that comes up. But then we need to decide as a country which is more important to us, the future of our children, the future of the young people of this country, or the economic gains that we are getting. And I am not sure about the cost to the economy, the cost to the fiscus of all the repercussions of dealing with issues of alcohol, the issues that are dealt with by the Department of Health in terms of our hospitals. We had a situation in 2020 when we were dealing with COVID, where alcohol was totally not being sold. And we saw the impact of that on the status of our communities and what was happening in our communities. We've got a challenge that we've got liquor licenses that are being given like sweets, unfortunately, in our communities. And sadly, it is those communities that are not exactly structured well and they don't have functioning local drug action committees that you find that a lot of these liquor establishments, like the taverns, that's where they are operating. And there is absolutely no control on how they are then operating. There's no compliance with even the legislation that exists in those provinces. I just finished, Stephen, a webinar that we had with the South African Alcohol Policy Alliance, as well as the SAHRC and other players and other departments of government, where we were talking about this very thing, to say we need to start putting action to our words. We've got legislation that is good. We've got legislation that is amazing, that the whole world looks at in South Africa and says, this is the best legislation that we could have in terms of the National Drug Master Plan that is. But then when it comes to actually enacting that, actually implementing the National Drug Master Plan, getting coordination by government departments, working together, getting coordination and getting establishment of local drug action committees, that is then not happening. And those are the things that we can start with. Those are the things that we can start with at community level, and then we can see if then the other things like increasing the amount that people pay for alcohol, that's then something else that we can do. But we actually have things in place. We have legislation in place. We've got strategies in place. We just need to get ahead and implement those strategies that we already have.
Nomcebo, is the alcohol industry just too powerful in South Africa? Is it able to lobby to, I don't know, would manipulate be the right word? I mean, certain laws have been on ice for a very long time. They have a lot of money. I mean, is it just too powerful?
Well, I would not want to say that they're too powerful. We are South Africans. We need to then stand up. Even if they do have money, they do have some kind of power. If communities, all communities in South Africa and all of society in South Africa stands up and we actually state what we want, we might just see ourselves bringing change. But if we are so scared and so fearful of what might happen, and then we are not able to push in the right direction, we're talking about the future of our children here. I do not know if money can ever buy a person's life. The 21 lives at Enyobeni, and this afternoon I got to learn that there's another child in George who was killed just last week. And this continues to happen in all communities. So the alcohol industry may be having the money, maybe having the power, but maybe it's about time we sat down and had a discussion with the alcohol industry to find what can be done and done better. Because we understand that we need the taxes, we need the money that comes from the industry, but then at what cost? And those are the discussions that we need to have as a nation. At what cost are we willing to allow this to happen?
Nomcebo Dlamini, thank you. Deputy Chair of the Central Drug Authority. Really do appreciate the time.